Ever wondered why pain seems to be a universal experience? Pain is our body's way of telling us that something is wrong. It's a sensation we're all too familiar with, whether it's a mild headache, a sudden toothache, or chronic pain from an underlying condition. It's in these moments that many of us reach for a common ally: Tylenol. This over-the-counter medication has become a household name, renowned for its pain-relieving and fever-reducing properties. Throughout this video, we'll delve into the world of Tylenol, exploring its active ingredient, acetaminophen, and how it works within our bodies. We'll discuss its uses, potential side effects, and precautions to take when using it. We'll also delve into the impact of alcohol on Tylenol and its safety during pregnancy. Knowledge is power, and understanding this medication can help us use it more effectively and safely. Join us as we delve deep into the world of Tylenol, your secret weapon against pain. Tylenol, known for its pain-relieving and fever-reducing properties, contains the active ingredient acetaminophen. Unlike non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen, acetaminophen does not reduce inflammation. Instead, it works in the brain to change our perception of pain and lower the body's temperature. This makes it an excellent choice for conditions where inflammation isn't the primary issue. It's also gentler on the stomach than NSAIDs, making it a good option for those who have experienced stomach discomfort with other pain relievers. But don't let its over-the-counter availability fool you. Tylenol is powerful, and it's important to take only the recommended dose. Overuse can lead to serious liver damage. So, while Tylenol can be a key player in managing pain and reducing fever, it's not a medication to be taken lightly or without thought. While Tylenol is effective, it's important to use it responsibly. Tylenol is a common choice for managing a variety of pain-related scenarios. This over-the-counter medication is known for its ability to relieve mild to moderate pain, making it a popular choice for a myriad of discomforts. From tension headaches and toothaches to muscle aches and menstrual cramps, Tylenol is there to provide relief when you need it most. But it's not just about pain. Tylenol's fever-reducing properties also make it a standout choice for managing body temperatures that are higher than normal. Whether it's a child battling a high fever or an adult fighting off symptoms of the flu, Tylenol can be a helpful tool in your wellness arsenal. It's important to remember, though, that Tylenol is not a one-size-fits-all solution. The amount that works for one person might not be the same for another. Dosage matters, and it's crucial to follow the recommended guidelines to ensure safe use. But remember, dosage matters. Exceeding the recommended dosage of Tylenol can lead to serious side effects. It's essential to understand that Tylenol, like any medication, can be harmful if not taken responsibly. This is why we need to delve into the importance of adhering to dosage guidelines and understanding the potential risks associated with overdose. Tylenol's active ingredient, acetaminophen, is a powerful compound with the ability to relieve pain and reduce fever. But it's also capable of causing harm, especially to the liver, if taken in excess. Liver damage is a severe consequence of acetaminophen overdose, emphasizing the importance of sticking to the recommended dosage. For most adults, the maximum daily dose is 4,000 milligrams. That's roughly equivalent to 8 extra-strength Tylenol tablets. This limit includes all sources of acetaminophen. It's found in many over-the-counter and prescription medications, often combined with other active ingredients. So it's crucial to check the labels of any other medications you're taking to ensure you're not unknowingly exceeding the daily limit. Taking more than the recommended amount can show no immediate symptoms but can lead to a potentially fatal condition known as acute liver failure. Symptoms of this condition may surface only after several days and can include jaundice, confusion, bleeding, and even coma. If you suspect an overdose, it's crucial to seek medical attention immediately. The risk of liver damage is also higher in individuals who have pre-existing liver conditions, those who consume 3 or more alcoholic drinks per day, and those who take more than one product containing acetaminophen. Therefore, if you belong to any of these categories, it's advisable to consult your healthcare provider before using Tylenol. Lastly, remember that Tylenol is not a cure-all. It's a temporary solution designed to relieve symptoms, not to treat the underlying cause of your discomfort. If your symptoms persist despite taking Tylenol, it's a sign that you need to consult your healthcare provider. So always check the label and avoid combining medications containing acetaminophen. It's a simple step, but it can make a significant difference in ensuring your safety and the effective use of this popular over-the-counter medication. Like all medications, Tylenol comes with potential side effects and interactions. Let's dig into some of those now. The common side effects of Tylenol are usually mild and transient, with nausea, stomach pain, and allergic reactions at the top of the list. However, it's important to pay attention to any unusual symptoms. If you do experience any side effects that persist or worsen, don't hesitate to seek immediate medical attention. Now let's talk about a serious but rare side effect: liver damage. This can occur if you exceed the recommended daily dose of Tylenol, which for most adults is 4,000 milligrams. This is why it's crucial to always check the labels on your medications, as acetaminophen, the active ingredient in Tylenol, is often found in other over-the-counter drugs as well. Moving on to drug interactions, Tylenol can interact with several other medications. For instance, if you're on blood thinners, certain antidepressants, or specific types of antibiotics, combining these with Tylenol may alter the effectiveness and safety of both drugs. In some cases, these interactions could lead to serious health risks. Now you might be thinking, well, I'll just take Tylenol on its own then. That's a good start, but remember, even food and drinks can interact with medications. For example, combining Tylenol with alcohol can put extra strain on your liver, potentially leading to liver damage. So what's the bottom line? It's simple. Always consult with your healthcare provider before combining medications. They can provide personalized advice based on your health history and current medications. Remember, Tylenol is a safe and effective medication when used responsibly. That means sticking to the recommended dosage, paying attention to potential side effects, and being mindful of interactions with other drugs. Your health is precious, and while Tylenol is a powerful tool for managing pain and reducing fever, it's important to use it wisely. Always consult with your healthcare provider before combining medications. Mixing Tylenol and alcohol can put your liver at risk. This is because both substances are processed in the liver. When consumed together, they can cause an overload, leading to liver damage. This damage is not immediately apparent, but over time it can lead to serious health complications. Now you might be thinking, I only have a glass of wine or a beer once in a while. Is that really a problem? The answer, quite simply, is yes. Even moderate drinking can increase your risk when combined with Tylenol. What about the occasional cocktail when you're taking Tylenol for a headache or fever? Again, it's best to err on the side of caution. Remember that both alcohol and acetaminophen, the active ingredient in Tylenol, put strain on your liver. Combining them simply amplifies this effect. In conclusion, it's best to avoid alcohol when taking Tylenol. Your liver will thank you for it. Pregnant individuals often wonder about the safety of medications. When it comes to Tylenol, it's frequently recommended as a safe choice for pain and fever management during pregnancy. The Food and Drug Administration, or FDA, classifies Tylenol as a Category B medication. This means that no adverse effects on fetal development have been observed in animal studies. However, it's important to note that this doesn't guarantee its absolute safety in humans. Therefore, it's always crucial to discuss any medication use with your healthcare provider during pregnancy. They can provide personalized advice based on your overall health, the stage of your pregnancy, and any potential risks associated with the medication. Remember, while Tylenol is generally considered safe during pregnancy when used correctly, every individual is unique, and what works for one person may not work for another. Always consult your healthcare provider before using any medication during pregnancy. Understanding Tylenol can help you use it safely and effectively. Through this journey, we've unraveled Tylenol's therapeutic prowess, its uses for alleviating pain and reducing fever, and its distinction from other non-steroidal anti-inflammatory drugs. We've also underscored the importance of adhering to recommended dosages. Remember, exceeding the limit can cause serious liver damage. We've shed light on potential side effects and drug interactions, emphasizing the need to consult healthcare professionals before mixing medications. We've also touched on its compatibility with alcohol, or rather, the lack thereof, and its general safety during pregnancy. However, regardless of its widespread use and availability, it's crucial not to underestimate Tylenol's potency. Like any drug, it should be used with caution, respecting the guidelines and understanding the possible risks. Remember, Tylenol is a powerful tool against pain when used responsibly.